Hi, my name is Mark Lee. I'm the Orthopedic Trauma Fellowship Director here at UC Davis. And I'm excited today to tell you about our Trauma Fellowship program. One of the most unique part of our training programs is that we have a very diverse faculty makeup. As opposed to some programs where everybody trains at the same place and stays there, our faculty all come from different backgrounds. Dr. Walensky, he's our senior member of our faculty. He's been here the longest. He brings a training sort of from the East Coast perspective where he did his training and worked. He actually is trained in the very classic orthopedic traumatology and sort of focuses on upper extremity trauma. Ellen Fitzpatrick is another one of our partners. She's our youngest partner. She actually trained at the East as well, but did her fellowship at Allegheny. She focuses on lower extremity trauma. John Eastman is our other partner. He's our partner focused on pelvic and acetabular trauma. But he, like all the rest of the partners, do all sorts of trauma, but we all have our subspecialty interests. John trained as a resident here and then trained for fellowship in the Pacific Northwest. UC Davis Trauma Fellowship is one of the longest running trauma fellowships in the country. Being one of the first trauma fellowships, we feel like we have a good experience at training people in the art of orthopedic trauma. Our program takes 2 fellows a year. We think it's a perfect number to fit into the way we like to train people here. The program here is ideally located, I think, because we're at a high energy trauma center here at UC Davis in Sacramento. This trauma center here is sort of in the center of a large catchment area for all of Northern California. The benefit of that is that we see all of the most complicated trauma from the Bay Area all the way to the Oregon border. And so the nice part of that is we get to see complicated acute trauma, and then we also get all the referrals for trauma reconstruction. I think what sets our program apart from a lot of other programs is that our program really focuses on technical excellence for our fellows. Because we have such great substrates, such great complex cases to work on, I think you get to learn sort of the state-of-the-art techniques in the most challenging ways. I think one of the things we're most proud of is our pelvis and acetabular experience. Under John Eastman, who's our pelvic surgeon, you learn complicated open and percutaneous techniques for fixation and reduction. And I think the volume of pelvis that our trauma fellows do is pretty much unmatched in the country. We also have a very good reconstructive practice here. We take care of lots of failed fixations and quite a few neglected fractures as well. So the non-union, malunion experience here is quite robust. And I think that's something that's very unique among fellowships, is that that added experience of a good reconstructive practice as well. The Med Center itself is a great place to do a trauma fellowship. We have a strong residency program here. Our fellows incorporate in with our residents, and our residents really do welcome the fellows here. You become a member of the team, and that's a nice way to go through the year. The residents end up looking up to our fellows as teachers, as support. So that's a nice part of the training here. Additionally, I think that it's good to work at a place like Davis, especially this health system, because we have really a state-of-the-art facility here. Our operating rooms have all the newest technology that you can imagine. We can get all the implants that you'd ever want to use. So it's a really wonderful physical plant to work at. Finally, I think we've been doing this for a very long time. We do it in a sort of a different way, in that it's a sort of a mentorship model where you don't rotate onto different services. We sort of keep you with us throughout the year, rotating with the different faculty. So one thing that's nice about that is that we can definitely tailor your educational experience. We can figure out the things that you're good at, things you need to work on, things you want to work on. And I think we've had a lot of success in training people to go into both academic and or community practices. And so, as I look at it, looking back now, having been here almost 20 years, I think we've really done a good job at developing this fellowship into something unique and a really good training experience. And, if I were to go back and train, I certainly think I would look at this as one of the one of the best places to train. And I hope you give us a chance and come and check out our program.